Welcome to the Center for Advanced Studies in Child Welfare. This module is entitled Parents' Health Literacy and its link to children's health and mental health service utilization and outcomes in Asian and Latino American immigrants. My name is Houa Vang, and I will be your narrator during the module. I am a research assistant for Dr. Hyun Lee at the University of Minnesota's School of Social Work. Dr. Lee is a professor and director of research. Her major research areas are cancer health disparity, cancer and health literacy, and family violence among underserved minority populations, with a particular attention paid to immigrants and refugees. To begin, in this learning module, we would like to share some background information on health literacy. Health literacy has recently emerged as an important social determinant of health outcomes as a result of its significant association with physical and mental health disparity. According to Ratzan and Parker, health literacy refers to the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Mental health literacy is a concept under development. The term was first used in research by A.F. Jorm and colleagues in 1997. An accepted definition of mental health literacy is knowledge about mental disorders combined with beliefs about mental disorders, along with the ability to access, understand, and use information to recognize and manage mental health disorders. Overall, you should know that health and mental health literacy have to do with how well people understand and are able to use important information to make decisions about their health. So why is health literacy important? Health literacy is important because it impacts health outcomes. Low health literacy rates are all too common among significant portions of the U.S. population. The costs of this phenomenon add up. This is related to limited awareness of health symptoms, lack of knowledge of where to seek services, limited ability in identifying illnesses, and decreased health service utilization. Continuing on, studies have cited multiple reasons for why health literacy plays a key role in these disparities. One such reason has been the way low health literacy negatively impacts timely access to and use of existing health services. Furthermore, low health literacy has been shown to limit an individual's ability to effectively communicate with physicians and care providers, implement self-management skills, understand medical terminology, and follow medical instructions. Why is mental health literacy important? Parents with low mental health literacy may not know about the vital relationship between social and emotional well-being and child development. There is low knowledge about mental health disorders by the general public. A lack of understanding on how to recognize a mental disorder, and there is poor knowledge about effective self-help strategies or how to seek for help for oneself and others. Without the knowledge and awareness, this can impact health outcomes of individuals. Approximately 13% of children between the ages of 8 and 13 years old had a diagnosable mental health disorder. Among these children, Asian Americans and Native Hawaiians/other Pacific Islanders had the highest rates, respectively between 21 to 22%. Asian Americans may be of particular interest due to the underutilization of mental health services and high levels of stigma about mental health in Asian American populations. Low levels of parental health literacy are a concern because it is not only impacting their own health outcomes, but also their children's health outcomes. Yin, Johnson, Mendelsohn, Abrams, Sanders, and Dreyer's study with 6,100 parents from the 2003 National Assessment of Adult Literacy, a survey of more than 19,000 adult Americans, found that 1 in 4 parents have limited health literacy skills, and only 1 in 7 parents are categorized as having proficient health literacy. Notably, 1/3 of U.S. adults are not able to perform basic child wellness tasks, such as following immunization schedules and interpreting growth charts. Furthermore, Betts, Roussillon, Mesk, Smith, and Chang's review found that parents with limited English proficiency are more likely to report having ill children and be uninsured, as well as less likely to use medical services when needed. Additionally, these parents reported having lower levels of parental education and spending more time in emergency care. Zaslow, Heer, Dayan, Aluwalia, and Sargent found that children raised by mothers with low health literacy had worse developmental outcomes and exhibited more depressive or withdrawal behaviors. Children living in families with low health literacy also are more likely to experience medication errors, have unmet health care needs, and more emergency department visits. However, when children already have a serious health condition, adequate health literacy among parents is even more relevant. As a result, these children subsequently missed more days of school than children whose parents had higher health literacy. These research supports the relationship between parental health literacy and child physical health outcomes. Here we see that parents are often in control of their children's health decisions. Parents may also be the gateway from which we can address disparities in child mental health outcomes. Parents who have lower health and or mental health literacy may have difficulty in reading prescription bottles for him or herself and for their children, complete any forms, understand given explanations about the health risks, follow written and verbal instructions, or navigate the healthcare system. It has been widely reported that immigrants who recently arrived in the U.S. have the lowest levels of health literacy. The National Assessment of Adult Literacy reported that racial/ethnic minority groups had disproportionately low health literacy levels. However, while immigrants as a whole may have a low level of health literacy, little is known about the levels of health literacy among distinct ethnic groups of immigrant populations. and whether they differ. Moreover, to our knowledge, no study to date has explored the relationship between a parent's health literacy and their child's health outcomes in specific racial/ethnic immigrant groups. Although health literacy is a critical factor in terms of health disparities and children's health outcomes, particularly among immigrant populations such as Asian American and Latino groups, there is a lack of literature focused on immigrant and U.S. born parents. Consequently, a deeper understanding of parental health literacy and its impact on children's health is necessary. This study, therefore, aims to investigate the impact of parental health literacy on children's health and mental health outcomes among Asian and Latino American immigrant parents. We hypothesize that the immigrant parents will have a lower level of health literacy than their U.S.-born counterparts. We further hypothesize that, in general, parents with higher health literacy will also have children with more positive physical health outcomes when compared to children of parents with lower health literacy levels. In addition, we believe that this relationship will differ across the subgroups. The study's findings will help to customize educational messages and future intervention strategies aimed to raise parental health literacy regarding their children, which will ultimately enhance their children's health and welfare. 3 research questions of interest are: what are the level of health literacy in Asian, Latino, and white parents? Are the health literacy levels of Asian and Latino American immigrants' parents related to their mental health outcomes? And are the health literacy levels of Asian and Latino American immigrant parents related to their children's health outcomes? This study used the data collected from the 2007 California Health Interview Survey, also known as CHIS. The CHIS is a cross-sectional telephone survey of the non-institutionalized population residing in California that collected data from households that had at least one parent and one minor child. It is administered in 5 languages, including English, Spanish, Chinese, Mandarin, and Cantonese, Korean, and Vietnamese, and oversamples Asian Americans. Moreover, the 2007 dataset contains items related to health literacy, as well as parental health condition, and the mental and physical health outcomes of their children. The original sample consisted of 5,148 adult participants aged 18 and over, and 9,913 participants aged under 12. For the children, their parents answered the survey on their behalf. However, our study sample will include only Asian American immigrant parents born outside the U.S. and their children. Child's self-rated health status is the dependent variable and was assessed using the item: in general, would you say child's health is excellent, very good, good, fair, or poor? Participants responded using a 5-point Likert scale. For depressive symptoms, a 7-item scale on a 3-point Likert scale ranging from not true to certainly not true for children. These items included 1. Child is generally obedient. 2. Child often seems worried. 3. Child is often unhappy, depressed, tearful. 4. Child gets along better with adults than other children. 5. Child has good attention span. 6. Child has difficulty with emotions, concentration, behavior in the past 6 months. And 7. Child's emotional difficulties, minor, definite, or severe. For adolescents, a 6-item emotional functioning scale on a 5-point Likert scale ranged from all to none. These items included 1. How often did you feel nervous? 2. Hopelessness. 3. Restless/fidgety. 4. Depressed and cannot be cheered up. And 5. Felt everything was an effort. And 6. Worthless. Parental health literacy is the independent variable. The 2007 CHIS includes 2 items that address health literacy. These items are: when you read the instructions on your prescription bottle, would you say it is 1. Very easy, 2. Somewhat easy, 3. Somewhat difficult, or 4. Very difficult to understand? And the second item: when you get your written information at a doctor's office, would you say that 1. It is very easy, 2. Somewhat easy, 3. Somewhat difficult, or 4. Very difficult to understand? While we acknowledge that these questions may capture only one dimension of health literacy, they have been demonstrated to be valid proxies for health literacy by the Commonwealth Fund's 2006 Quality of Care Survey. This study will also include control variables, including the parent's age, gender, whether they live in a rural or urban area, their income, and English proficiency. It will also include variables on their children's age, gender, current asthma status, ADHD, insurance, dental insurance, and general health status. Univariate analysis will be used to assess the health literacy levels of the aggregated and subgroup Asian American immigrant parents. To determine if there were any significant disparities in health literacy, we will be conducting a series of t-tests comparing the aggregate group with each subgroup, as well as between each subgroup. Furthermore, the relationship between the parents' health literacy and their children's health outcomes will be assessed utilizing multiple regression analyses. Weighted health literacy values will be utilized for all analyses. Due to the complex sample design of the CHIS, this study will use replicated weighting methods created from Strata 12.0 to produce unbiased estimates using a valid variance estimation. The parental respondents were primarily non-Latino whites. which made up 60.5%. Females, who made up 62.2%. Married individuals at 77.1%. Most lived in an urban location at 81.5%, and had an average age of 38.76 years. The children that the parents provided information on were closely split between genders, with an average age of 5.62 years. Parents reported that the children primarily had excellent health. Our results indicated that Latino U.S.-born Latino immigrant and Asian immigrant parents all had significantly lower health literacy levels than non-Latino white U.S.-born parents. However, there was no significant difference in average health literacy levels between Asian U.S.-born parents and non-Latino white U.S.-born parents. Average health literacy levels were also significantly different between U.S.-born and immigrants for both Latinos and Asians. Again, here is a graph that shows the mean of health literacy between race and ethnicity. Our findings show that parental health literacy did not predict mental health outcomes in any groups. Overall, health literacy was a significant correlate of child health outcomes only for children of Latino U.S.-born, Latino immigrant, and Asian immigrant parents, such that higher health literacy was correlated with reports of better child health. For children of Latino U.S.-born and Latino immigrant parents, parental health literacy was the only significant correlate of child health outcomes. For non-Latino white immigrant parents, child gender and parental marital status were significant correlates of child health outcomes. In this group, male children and younger children reported higher child health outcomes. For children of U.S.-born parents, child gender and parent age were significantly correlated to child health outcomes, such that male children and children of older parents reported higher health outcomes. Here we see in the bold that health literacy is the only significant correlate of child health outcomes for Latino U.S.-born. Here we also see again in the bold that health literacy again is the only significant predictor for child health outcomes for Latino immigrants. And lastly, again in the bold, health literacy was also a significant predictor for Asian immigrants. Not only that, child gender was another significant correlate of child health outcomes, in addition to health literacy for children of Asian immigrant parents, such that parents were more likely to report that male children had better health than female children. In this present study, health literacy did not predict mental health outcomes for any of the groups. This suggests that health literacy may not be a barrier to poor mental health. Health literacy may be low in immigrant populations such as the Latino group, and it may not be a barrier for mental health outcomes. As for health outcomes, health literacy was a significant predictor for Latino U.S.-born, Latino immigrants, and Asian immigrants. This suggests that health literacy may be a critical barrier to poor health outcomes for certain groups. Limitations in this study included the health literacy construct. Although previous research suggested that the two-item health literacy scale is a good representation of health literacy, the scale had low reliability for our sample, which could have impacted results. Secondly, the sample did not look at sub-Asian or sub-Latino groups. The results suggest that poor health literacy may be associated with lower health outcomes for children among Asian and Latino parents. Therefore, practitioners need to recognize poor health literacy and devise ways to increase health literacy among their clients. There are a variety of health literacy screening tools available for different populations. The most commonly used is a one-item question. How confident are you filling out medical forms by yourself? Extremely, quite a bit, somewhat, a little bit, or not at all. Another screening tool is the two-item questionnaire from CHIS. When you read the instructions on your prescription bottle, would you say it is very easy, somewhat difficult, or very difficult to understand? When you get your written information at a doctor's office, would you say it is very easy, somewhat difficult, or very difficult to understand? A third health literacy screening tool is a three-item questionnaire. How difficult is it for you to get advice or information about health or medical topics if you needed it? Understand information that doctors, nurses, and other health professionals tell you. Understand written health information with a scale ranging from very easy, somewhat difficult, very difficult, and I do not know. These are just a few examples of health literacy screening tools that practitioners can utilize. Thank you for listening to this module. We hope you were able to increase your knowledge about health literacy and how parents' health literacy can be linked to their child's health outcome. Following this slide is Dr. Hee-Young Lee's contact information.